Hey, good afternoon and welcome to another edition of Health Sense right here on 1FM 91.3, supported by Glen Eagles Hospital. Now, the theme for today is Oh Man, where we talk about manly issues. Now, we're dispensing important health advice for viewers who are thinking of running the Standard Chartered Marathon, and we'll also discuss the Movember movement, which is also very, very important for men all over the world.
We have a cardiologist from Glen Eagles Hospital, Singapore, Dr. Rohit Khurana with us. Thank you so much for joining us, Doctor.
Welcome. Thank you for the invitation.
Thank you for being here, Doctor. Okay, so let's talk marathons, right? How healthy are marathons?
Well, it's not a question of how healthy marathons are. I mean, there's a lot of data that exercise in any shape or form is good for you at whatever stage of health you're at, whether you're a young person, whether you're a heart patient. Exercise, aerobic exercise, is endorsed by the guidelines. It's endorsed by all cardiologists and physicians generally that exercise is good for you. Marathons are, of course, one extreme form of exercise, which we're going to be talking about. But exercise, in principle, when it comes to cardiovascular health, has shown benefits at all levels, really. Blood pressure lowering, weight loss, mental health, cholesterol lowering, metabolism of glucose and reducing the risk of diabetes. So on many, many levels, exercise is good for you. But specifically marathons, it's an endurance event, as we all know. And it's something which, as you've just said as well, it's increasingly popular. Yeah. And many, many more people are taking up personal challenges to do these endurance events, not just marathons, but triathlons and ultra marathons and Spartan events, and there's so many things taking place. So we have to be prepared as doctors to be able to make sure that people are not putting themselves at undue or unforeseen risks for themselves.
All right. What happens to your heart when you run long distance marathons like
that? Right. It's, of course, the heart is under a constant strain. The resting heart is between 60 and 90 beats per minute. During a marathon, you're essentially putting your body through a repetitive strain injury. And so heart rates reach between 100 to 140, depending on the level of fitness. And as you can imagine, people are running for several hours. So, essentially, you're putting your body through a form of repetitive micro-injury. That's essentially what happens. And of course, with the excessively beating heart for long periods. Right. And of course, with that, you do get signs of strain injury. There are measurements that we can measure in the blood when people have finished a marathon, and you get micro damage, which is reflected in blood tests. So we do know that people are doing themselves some form of strain. Whether it's dangerous in the short or long term, the data would not seem to suggest it is. But ultimately, in the short term, you are incurring some repetitive injury.
So I think I've made the right decision all these years.
All these years?
Because I've always turned down extremely long distances.
Yeah.
So I do a 10 kilometer. I feel very comfortable and very good after a 10 kilometer run. The longest I've done is a 15 kilometer run.
Yeah.
I didn't quite like it, as much. Now that I'm growing older, I am a little bit more cautious.
Yeah.
I still am active. I do a few. I go for my runs and all that. 5 kilometers, maybe 8 kilometers, and I feel that that's enough for me.
Yeah.
The thing is, I see more and more people who are in their late 40s and mid 50s. Wanting to prove to themselves that they can still do it. And sometimes I fear for them.
Very, very, very common. And that's probably the cohort that are the most vulnerable. When we sort of hear of these startling events, these sort of sudden tragic events, of course, you don't expect it, when people are exercising, because everybody is told to exercise, and it's counterintuitive. Right, to have a problem when you're exercising, and when it happens, of course, it makes the front pages of the newspapers, it makes the front pages of social media, and so on. And we can talk a little bit about what causes cardiac problems during exercise. But that group you've just alluded to, this sort of middle-aged male group, middle-aged men, who are in their 40s and 50s and want this sort of born-again, conviction, that they're invincible and that they can do these endurance events. They need to be more careful, because they're the ones who have, a lifetime of risk factors which can ultimately catch up with them, during an endurance event. So when I mean by risk factors, they may have been smokers in their former years, they may have stopped, but they may have been ex-smokers, they may have had a history of being, they may be overweight, and we know that being sedentary for too long a period is a risk factor for developing heart disease. They may have a family history of heart disease, and everybody is familiar with what their own genetic risk might be in terms of their parents or brothers and sisters and grandparents. People may have a family history. They may have a history of high blood pressure. High blood pressure in the aging society is more common, even though people may take good care of themselves. And those risk factors lend themselves to blockages. Right. Which develop in the arteries, and it's part of the aging process. And when you get to that middle-aged group, it's the heart attack risk that can happen during an endurance run that can sometimes, unmask itself and declare itself.
Yeah, I mean, I understand that when you're talking 40 to 50s, but we've also seen a lot of people early 30s who run a marathon, and halfway through, I mean, I hate saying it, they drop dead.
Yeah. And again, there's sort of bombshells that happen, and nobody expects these very fit young people to have, a tragic event, a sudden cardiac event that results in a tragedy. And I think, there is a spectrum of heart diseases, which some people may have been screened for, other people may not have. And unfortunately, medicine is not a perfect science. Even if some people have been screened, it's very, very rare. The first time they're aware of a cardiac problem is when they suffer a fatal event. Now, we'll put it in perspective. I mean, it's very, very rare. These sudden cardiac events and sudden cardiac arrests that happen in these younger people. There was a study that was published, I think in 2012 in the New England Journal, that took about 2 million US marathon runners and estimated the incidence of a cardiac arrest during a marathon to be about 1 in 100,000 runners. Now, of course, we're seeing a lot more people today running marathons. So statistics will eventually catch up, and we will hear of young people having events. And that's ultimately, what we do screen for. We screen for a different type of problem in younger people than we do in that 40 to 50-year-old male age group. In the younger age group, it may be because they've got an inherited structural heart problem, an inherited cardiac arrhythmia, or it may be that they're extremely unlucky and during a run, they may become very dehydrated, they may not have trained properly, they may get electrolyte and salt balance disturbances, and that ultimately translates into a dangerous rhythm disturbances, and people collapse and have a cardiac event. So we're talking about different types of disease issues in the younger population, luckily, which we can screen for, although it's not a perfect science, compared to that 40 to 50-year-old age group, which are more affected by blockages.
So if we're running a marathon, as when you run a marathon, you listen to your body as you run, don't you?
Right.
So
I mean, I always listen to my.
Yeah, I worry.
It's getting tricky though.
Yeah, I see a lot of people around where I stay. They run. I'm just wondering how many of these people actually know how to listen to their body.
Yeah, I mean, you use that term, and it's a term which is commonly thrown around, listen to your body, but essentially, people who exercise regularly do know themselves. They know what they know themselves better. They know what level of fitness they're able to do. They may go for brisk walks, they may climb a few stairs, they may go for a 5-kilometer run.
Right.
They know what they can push their body through without feeling any symptoms. Now, when you use that term, listen to your body, it's because ultimately then they may notice a difference. They may see their stamina unexpectedly, or for no real countable reason. They may see it reduce.
Yeah, right.
They may get a bit more breathless or more wheezy. They're not asthmatic.
Right.
They may start to notice their heart palpitating a bit more, which you're more aware of a fast heart rate.
Right.
They may feel a little bit more giddy, or some people in more extreme sensation may get some chest discomfort. So people start to know when they're having something different to what they normally feel when they're regular exercisers. Right. And when they notice a change, and it's a very personal feeling when you're exercising, and it depends also what level of fitness you're at when you're exercising. I have patients who are extremely fit, and they're very in tune with their body, and the slightest difference in sensation concerns them. But you have people who are extremely unfit and they're starting from a much lower baseline, and they have symptoms which are much more classic. So it all depends on the individual and how you interpret symptoms when it comes to thinking, has this person got or not got a cardiac issue that we need to investigate further? Really depends on how well they know themselves and the difference in symptoms they're getting from their own personal baseline.
Right. Go ahead.
We are talking to Dr. Rohit Khurana, cardiologist at Glen Eagles Hospital, Singapore. And if you've got any questions right now, I mean, we are live on Facebook. Please feel free to hit us with those questions, okay? Back to, I would like to ask you, Doctor, this question. If one of your patients were to come up to you, and he's in his 40s, he's had a heart condition before, maybe a stent or two.
Yeah.
And if he were to tell you, doctor, I want to run a marathon, what would you say?
Yep, that's a very good question, because that is quite a common situation these days. So the first thing to say is that, there's no hard evidence to stop them. Okay. I mean, one should always, be a little bit more careful when they've got a past cardiac history. But there's no very, very strong data, no compelling data to say that if you're a cardiac patient, and often why it's important is because when people have had a cardiac issue, they do want to prove themselves that they can get back to a level of fitness, which is why it's a very common situation, this. But there is no hard and fast data to stop them from doing a marathon. But again, they should have a proper check before they go and do it.
Right.
Which means to make sure that their risk factors that would otherwise predict a recurrent cardiac problem is well controlled. Their cholesterol, their blood pressure, their sugar, and their just their general fitness is evaluated, which they would have done anyway as being a cardiac patient, but just to make sure that those risks are as well controlled and as optimized as they should be. But it's very hard to stop somebody.
Right.
But the challenge we have as doctors, even though intuitively you think you shouldn't be going out there and doing a marathon, do a recreational run, do a 5 kilometer, do a 10 kilometer run. But if you really want to challenge yourself, with a 42 kilometer run, it's very hard to stop people deep down if they're motivated to. Even if as doctors, we tell them they shouldn't do it.
I tend to think that
So we have to encourage them to do it safely.
Safely, that's what I was thinking, because I think if you're doing a 5 kilometer run in the evenings or a 10 kilometer run in the evening, it's totally different from doing a marathon where you are putting pressure on yourself to compete. And that adds to the strain, obviously, which puts a bigger strain on you.
Yeah, so I mean, but then of course we have in the media, you have well-known personalities who have had bypass surgery, they go on to do marathons. Right, and so it can be done, and it can be done. And you have these stories, the positive stories, which encourage people to go out and exercise. So the message is, absolutely go and exercise. It's a really, really important part of self-maintenance, and for all the things that we've talked about, chronic disease and chronic risk management is lowered. It's all beneficial, but as you say, listen to your body. If you have symptoms, then of course you should know when to stop and when to seek medical attention. And just be mindful that you should check in periodically with your doctor.
And just remember, try not to be like me. I am very sedentary, and these guys go for marathon runs, and I do the walk. And that's strain enough for me. Because my exercise is watching Netflix and lifting the beer up and down. That's my exercise
He
completely.
listens to his body all the time, and his body tells him, don't do anything, just watch TV.
I have a very weird body. I have a completely weird body.
But do you want to exercise?
I do.
So why don't you?
Okay, this is very simple. I have done it. I've gone through these phases in my life where I exercise and it becomes very addictive. And then I pull off. Now I found, I'm 63, and people go, it's all in your head. Every time I say I'm going to get down to exercising, I fall sick.
You fall sick when you start exercising?
No, before I even start, I will say, okay, I'm going to start.
This guy never exercised.
I'm going to start on Monday, and on Saturday, I'm sneezing and I've got a runny nose.
Yeah, well,
He's never exercised in his life. He hates it.
I think it's my body just saying, I'm not going to do it.
well, the thing is, but as we've talked about, you don't have to aspire to something which is, a big ambition. You don't have to aim for a marathon and just think to yourself, I'm going to do this.
Right.
You can start off with 5-kilometer runs, have a personal trainer, which seemed to be very in fashion
Right.
these days,
Yeah.
and gradually build up.
Yeah.
It's what I've been trying to tell him.
He's been telling me this.
2 steps forward, 1 step back, but 3 steps forward, 2 steps back. You're still making
You're
progress.
still making progress, aren't you?
I've become so lazy these days. I depend on my personal trainer to push me. I just turn up and he tells me what to do for an hour.
So, buddy, we're going to get into exercising, buddy.
We've been talking about...
Come for a courtesy screen now.
Yeah.
I should, because I do have 1 stent.
Right.
So before I do anything particularly strenuous, I really do feel I need to get a proper cardiac check, that's for sure.
Doctor, we've been talking about, running and all that. What about weight training?
Yeah.
Is that good for the heart as well?
It's a different form of exercise, and I think we always encourage people. It isn't just aerobic exercise that's important. I mean, resistance training and muscle toning is equally important, and that's for a different aspect of cardiovascular health. We always talk about being obese and having our sort of body fat being measured. We talk about this concept of lean mass and visceral fat, essentially as being independent risk factors. So that type of training is important. It's not as strenuous on the heart, but it's important in terms of conferring other benefits, such as reducing your fat, which we know is important.
Because we were just talking to a friend the other day who swears by his weight training. It's like, I don't need to run, I don't need to walk. So I just need to go to the gym and do my weight training.
So we encourage both. So we absolutely encourage both resistance and core weight training.
Right.
In addition to aerobic training, they offer complementary benefits.
Dr. Khurana, thank you so much for joining us. It's been a pleasure having you with us.
Thank you for the invitation.
Thank you.
Good times. Greatest hits. 1FM 91.3.